these are pressure insoles examples. The one on the right, the picture on the right, these aren't actually pressure sensing insoles. They're just more to enhance comfort within a shoe. The other two pictures do contain pressure sensors within them. These are some companies who now offer pressure sensors as a product. They're pressure insoles. They're intuitive to use, so anyone can have them and buy them and use them for whatever they need. The pictures are some diagrams of pressure insoles, just to show what they're made up of. And there's some facts about pressure sensors. As you can see, I said there again, there are now many brands with their own version of pressure sensing insoles. The insoles are now wireless, and you can connect them to a smartphone for data analysis, so they're really easy to use and intuitive. Okay, this is from Motorcon, which is a brand who sell pressure insoles, their own version. This data collection is from their website. I think they're just using it to advertise the product. So they used pressure insoles with a German football team, a professional German football team, and as you can see there's the force graphs during the movement and the pressure distribution with the picture of the foot. And then there's also the video of the player performing the vertical jump. And on the other side, you have the formula for pressure. And yeah. Okay, the picture on the left is a diagram of a sealed cavity pressure sensor. And then on the right is what it would look like if it wasn't a diagram. And that one's a Bosch MEMS pressure sensor. So the membrane of the pressure sensor is able to deform when pressure is applied to it, while force is applied to it. The deformation of the membrane causes two mechanical changes that we can use for transduction to an electrical measurement. So either the displacement of the membrane or the strain placed on the membrane can be calculated using complex equations, but these equations will give a value for the pressure that's being applied to the sensor. Okay, this is another example of biomechanical data that can be collected. Sort of how it's displayed with the graphs and the foot diagram for center of pressure or pressure distribution. Okay, this is so the force data can be used for load assessment during sport and activity. This can help reduce the risk of injury, mainly to the foot and ankle. So by analysing the force data, you can identify these mechanical risk factors for injury, and these are like techniques of movement that the performer is using that can increase a chance of a specific injury. And then at the bottom there I've explained how, again, other measures such as a force mat are too cumbersome to be used for data collection sometimes. So for example, during a football match, a pressure insole could be worn the whole match, collecting data the whole way through, whereas you couldn't do that with a force mat. And the pictures on the right are just example graphs from a study that used pressure insoles. Okay, so here's an example from a study where increased fifth metatarsal loading during athletic activities correlated with an athlete's history of fifth metatarsal stress fracture. So that study used pressure insoles, and as you can see, the results were when the performer is loading heavily through their fifth metatarsal, this correlated well with the number of metatarsal stress fractures they had previously had. Okay, and then this other study is on postural sway, measured using pressure insoles, and identified how it's a risk factor for ankle injury. Okay, this study was also on postural sway. They tested the athlete's balance and posture using this test. And the participants who were seen to have abnormal posture were affected a lot more by ankle sprains. So again, this is another way they can be used to predict injury. Okay, this study from the University of British Columbia performed a 15-week running program and did a lot of data force analysis using pressure insoles, and they found braking force was by far the best predictor of ankle injury. So overstriding and heavy foot striking with the heel increases braking forces. So then they gave these technique points to improve and reduce heel striking and braking forces of not overstriding and landing softly. So again, this shows how pressure insoles could be used to measure braking force during someone's running, and also identify them as a heavy heel striker, which can then be linked to their injury risk. And also, once you've found this out, you can advise technique changes, so implement an intervention to change their technique and make it better, so the performer is at less risk of injury. Okay, this is a diagram from Senogate's website. They're a company that offer their own version of pressure sensors, pressure insoles to purchase. So over-impact heel strikers tend to have more knee and hip injuries, whereas over-impact forefoot strikers tend to have more Achilles and calf strains. So this is a quote from their website where they explain what their theory is behind their gait analysis. So yeah. So again, these are more studies that support the theory of heavy heel strikers being more at risk of knee injury, whereas forefoot strikers having increased Achilles tendon loading, which put them at higher risk of stuff like calf strains, ankles and forefoot injuries. I included here that some studies have found forefoot running to increase the risk of ankle injury, whereas other studies have found heel striking increases the risk of ankle injury, just to show that there is a bit of argument on the topic, where a definitive answer hasn't been found yet, because results from studies have been mixed. So this is shoe design to counter heavy heel striking or forefoot running. So as you can see, the shoes have a heel counter, which puts the runner on their toes, so they're more of a forefoot runner than heel striker. Most of the studies I read said it would be better to make a technique change rather than just try and fix it by wearing a different shoe. But obviously some people are going to go for this quick fix. This is gait analysis with patients who have illnesses that affect their walking, so for example Parkinson's. The study at the bottom used pressure insoles as they were measuring. They were trying to identify elderly people who were at higher risk of falls. So they needed a flexible research tool that could be used just throughout the day and wouldn't interfere with the elderly people's daily life, and pressure insoles were perfect for this. On the other side, you have the Home Care Shop, which is a brand who are offering this product that they call diabetic insoles, and they've been designed using pressure insole data, and their main function is to reduce the likelihood of diabetic ulcers, and then they also have some other benefits that are in the top right corner. Okay, so how useful are pressure insoles for health and rehab? This is my final judgment. So I think overall they are very useful in health and rehabilitation for illnesses, and they'll be used a lot more in future. They are very promising, and they can be used in many different ways, which I'm sure people will think of. And then they've also been very useful in the sports performance side and rehabilitation, as a lot of running gait analysis has been done using them, and also obviously the shoe design. Okay, so this is the main use I can think of, and I've seen in studies, which is gait tracking, a performer's gait during rehab from an injury. So to check that the injury hasn't caused them to change their technique to be more inefficient or more at risk of injury. So then I put another rehab use could be checking force asymmetry after someone has recovered from a lower limb injury. So I use the example of an ACL reconstruction. So sometimes after this surgery, people overcompensate for the surgery limb by using the non-injured limb more. So more force is going through the non-injured limb. And this can have implications for injury in the future, so it should try and be avoided. And as I've said at the bottom, a physiotherapist may not be able to see this just with their eyes, so pressure insoles could be used to measure exactly how deficient the one leg is compared to the other. Okay, so these are just the references and images sources. The references. Okay, thank you.